There is your station.
Okay, ma'am.
Okay.
Okay, I'm ready.
Both are ready. All right. So if you've read and understood, considering it communication skill station, please begin.
Hello, I'm Dr. Ala, SHO working under Mr. Mann. I'm calling to speak for vascular consultant. Can I confirm that I'm calling vascular consultant?
Yes, I'm here.
Okay, sir. I'm calling you for accept a referral of patient with a critical limb ischemia.
Okay. Can you please summarize the
Yes,
case?
yes. 54 years old lady admitted for mild diverticulitis. She received conservative treatment, which is antibiotic and IV fluid, and her symptoms were improved. But now she developed sudden severe pain in her left leg, in her left lower limb. And we give her analgesia, but there are no response. On examination, the leg was pallor and cold and pulseless. In his investigation, ABG show metabolic acidosis with hypokalemia, and we do also ECG that show arterial fibrillation with premature complex, a premature ventricular complex. In addition, the duplex was made for her left leg that show acute ischemia in her leg. Please, sir, now I want to refer her to you for receive definitive management.
Is it urgent? Can you send it tomorrow morning instead?
Yes, it's urgent because we suspect or we confirm that there are acute limb ischemia, which may lead to lose her limb if we don't intervention urgently.
And do you need any cardiologist to review for the premature ventricular complex before the transfer?
I think we can be assist it later because premature ventricular complex caused or result of electrolyte electrolyte disturbance.
Okay. And
So we
what
can do
about
that
the
later.
okay?
Yes.
What about the diagnosis of diverticulitis? What do you think of her presumed diagnosis of diverticulitis?
Okay. Right now, after the diagnosis with arterial fibrillation with acute limb ischemia, we must consider that the cause may be mesenteric ischemia.
Mhm.
Yes.
Myocardial
So do you
infarction.
want to
Hmm?
myocardial infarction? You should consider.
Yes.
And do you
I
want to
consider.
scan the abdomen first?
I want to scan the abdomen, but I think that after the transfer.
Could it be mesenteric ischemia?
Yes, it could be mesenteric ischemia, but not likely to occur because her abdomen right now is lax and there are no tenderness in her abdomen. And I will make a serial abdominal examination. And if I need to do a CT with contrast to her abdomen, I will do that after check the renal function. And if the renal function is not normal, I will try to depend on the arterial duplex for mesenteric vessels. Also, I can use MRA, which is magnetic resonant angiography.
And how could you manage this case?
What do you mean by manage this case? The
I mean,
ischemia or
I
ischemia
mean,
or
you
yes.
said about electrolyte imbalance or and the
Okay.
premature ventricular complex.
Okay, I will start in CRISPR protocol, which is care of critical ill surgical patient. Then I will correct the hypokalemia, then correct the arterial atrial fibrillation. In addition, I will give her anticoagulant to prevent any emboli or thrombosis, and I can correct the acidosis also.
Okay. And what will you consider to manage the atrial fibrillation?
Please again.
And how will you manage the atrial fibrillation?
Yes, first
You
I
could
will
say.
arrange with cardiologist and ICU registrar. Then we can start to give her to correct firstly where we will correct the hypokalemia. Then we can give her beta blocker to control the rate of heart, and we can also give amiodarone for arrhythmia. In addition, we must give her anticoagulant to prevent any emboli or thrombosis.
Okay. So while transferring the patient, what type of ambulance will you need?
Okay. The ambulance, the best choice is air ambulance, which is helicopter. But if not available, I will transfer here by advanced life support ambulance with blue lights on, which is called level 1 ambulance. But the ambulance should be supported by CPR set and syringe pump for cardioversion drugs like amiodarone.
Okay. And you said that you will give anticoagulant. What type of anticoagulant you want to give?
Okay. We have two type or two choice. First choice is unfractionated heparin. Its dose is bolus 5,000 unit as a bolus IV, which is equal to 80 milligram, 80 unit per kg. Then I will complete the maintenance therapy with dose 18 unit per kg per hours as IV infusion. And the other choice is low molecular weight heparin. I will give 18 unit per kg per day under subcutaneous.
Okay. And can you tell me how could you manage the ischemic limb?
Can you manage what?
How can you manage the ischemic limb?
Ischemic limb. Oh, okay. First, I told about initial treatment, which is CRISPR protocol, but the definitive management is angioplasty with a stent or not, with or without stent, with embolectomy, and we must do fasciotomy to prevent any complication. Also, we can do thrombolysis if that is fresh, and if that failed, I will do bypass surgery.
Okay. And if the limb is not viable,
If the limb is not viable, this is question or information?
no question.
If the limb is not viable, I will do amputation for her. But we can
So,
know the limb is viable or not viable by a test which is called positive 2-point discrimination test.
and what will you tell her family?
Okay, I will explain what happened with her to her family. By said that she has a sudden severe reduction in blood supply or blood circulation in her leg, so we need to urgent intervention for her, and that why we need to transfer her to a vascular consultant.
Okay, doctor, you can send the patient over.
Good.
Okay,
Thank
thank you,
you.
mister. I suggest that first thing to give her anticoagulant, and we can do embolectomy and fasciotomy urgently. Thank you.
Thank you.
Thank you.